Joining us now to help break down all of these new developments, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, always good to have you with us. First of all, let's just ask the question that a lot of folks have been asking over the past few weeks, especially this uptick in cases that we are seeing. A lot of folks assert that it's because we're simply testing more. Fact or fiction?
Good morning, Craig. Good morning, Chanel. And I always thank you for platforming these issues. The answer to that, Craig, is it's not true. Cases are rising out of proportion to the amount of average tests that are being conducted nationwide, but particularly in the 26 states that you highlighted in that map. So that's really important to note, because this is not just a function, as we've heard in some circles, that we're testing more. That's part of the reason why, but the other big reason why is that we're seeing community transmission, that the local outbreaks now, places like Arizona that are concerning, Florida, Texas, California, our most populous states. So this is much more than just, hey, we have more testing online, and we need an appropriate response. Otherwise, this is going to become yet another out-of-control situation similar to March.
The sports world has also seen an increased number of cases. Major League Baseball reporting 40 players and staff members testing positive. Several college teams reporting numerous cases as well. This idea of teams getting back to action by putting players in a bubble, putting staff in a bubble, is that an approach that's feasible?
I think if everybody essentially consents to exposure and is willing to get exposed, and there's essentially a huge herd immunity amongst players and teams, then that's an approach. But this notion that we're going to somehow minimize transmission amongst players is virtually impossible. So to your point, I think it works because most people tend to be young. But there's older managers, for example, they go back to their families. So I'm concerned about the fact that you can't just create a bubble. It's impossible to create a bubble in this day and age. Those players at some point will go back to their families and could be lead to chains of transmission. So if you're going to be in that bubble, you're going to get exposed. There's no way to prevent that. You're going to see a lot more exposures as the MLB comes back online. The Phillies have already canceled their spring training in Clearwater. NBA is about to come back online, potentially 26 teams. You're going to see a lot more of this. So we're going to have some hard discussions, or the commissioners are going to have some hard discussions about what they will and will not tolerate.
Over the weekend, President Trump mentioned the possibility of slowing down testing at his rally. The White House later said he was joking about that. But they've also said that they are preparing for a new wave of cases in the fall. What should people be doing to protect themselves from another potential wave? You know, we're coming off a Father's Day weekend. I have to tell you where I am, the restaurants were packed. And I have to tell you, there aren't very many people wearing masks. I would say yesterday, I saw maybe 1 in 6, and the restaurants were packed.
Chanel, thank you for asking that question. I feel like a broken record saying this, but we have more data now than we even did 2 months ago, suggesting that if 90% of people wore masks in public, doesn't have to be all the time, but in public, when you cannot socially distance, COVID-19 would be gone. But you're right. I've seen the same thing, 1 in 6 individuals. So protect yourself and your children, your grandparents, your mom and dad. Wear a mask. We know it now works. Before we thought it worked. It made sense. Now we know it works. I would only engage in public if you can be in an outdoor setting for non-essential activities like restaurants and pubs. I would not go indoors. We think that is a huge nidus for super spreader events. It's very difficult. Now there's more data suggesting that even. And then I've also heard some concerning suggestions from experts that COVID doesn't exist on surfaces, so you don't have to worry as much about hand sanitizing. Please, if you're watching this, sanitize your hands with a hand sanitizer in your purse, or wash your hands frequently. Infection control at the top of mind is the most important thing. I'm hoping our government's going to focus on contact tracing and on some of these novel therapeutics that are coming online and accelerating their development. That, to me, is an adequate vision for a fall wave.
Dr. Vin Gupta. Dr. Gupta, thank you, especially thank you, since it looks like you're either about to start your shift or you're just getting off your shift. But either way, we appreciate you, brother. Thank you, Chanel.
That's right.